1 knob setting. 100 listeners. Some too loud. Some can barely hear. Same dose, different levels in different patients. 50 kilogram woman and 120 kilogram man. Same pill. Her concentration is twice his. Add age, genetics, kidney function. The curve is different for everyone. PC model predicts concentration over time. BD model predicts effect at each concentration. Together, dose to concentration to effect. Simulate before dosing. Loading dose fills the bathtub immediately. Without it, 4 to 5 half-lives to reach steady state. Maintenance dose keeps the level stable. Impaired kidney drain is blocked. Same dose, higher concentration. Hockcroft Gold estimates kidney function. Child Pew scores liver. Adjust dose or extend interval. Model-informed precision dosing. Population PC model is the prior. Patient drug level is the data. Bayesian update gives individual model. Dose to target. The weather forecaster applied to dosing. Dose response defines the relationship. Therapeutic window is a safe range. PCB-FET models simulate. MIPD personalizes. Every drug has a volume knob. Turn it just right.